Welcome our next speaker, Junmo from the Sungkyunkwan University. The title is Blood Pressure Assistant Cerebral Microbleed Segmentation via Meta Matching. Welcome.
Okay. Thank you for the introduction. I'm Junmo Kwon from Sungkyunkwan University. Today I'm going to give an overview of our paper, Blood Pressure Assisted Cerebral Microbleed Segmentation via Meta Matching. Oops, I'm sorry. Okay. So before we begin, what is cerebral microbleed, or in short, CMB? CMBs are tiny lesions that appear as dark spots on T2 star MRI. Sorry.
Maybe there's some technical problem. Yeah.
With the clicker, the red button
Sorry, it's not
is for going forward, and the red button is for going backwards, and the green button is for forward. Yeah.
So sorry about that. Yeah. So before we begin, what is cerebral microbleed, or in short, CMB? So CMBs are tiny lesions that appear as dark spots on T2 star MRI. CMBs are quite tricky to segment due to the small size and diverse voxel resolutions. So what's often overlooked in previous studies is that there are two subtypes of cerebral microbleeds. The first one is a lobar microbleed, which is caused by the accumulation of beta amyloid on the vessel walls. The second one is a deep microbleed, which is caused by the hypertension. So what is the motivation of our work? We are motivated by the strong association between deep microbleeds and hypertension. However, a major challenge is the lack of paired data where a patient should have both blood pressure measurements and the corresponding MRI scan. To overcome this issue, we utilize the phenotype prediction model that directly estimates blood pressures from T1 MRI scans. So this way, we can use the estimated blood pressure, so I can use to external data sets even without real measurements. Lastly, we use a novel fusion technique to combine medical text and estimated blood pressure. Here, medical text provides subtype level information and blood pressure provides subject level information. So how exactly do we estimate blood pressure? Starting from the raw T1 MRI scans, process them using the pre-freeze software pipeline, and perform an affine registration to the MNI space. Then the pre-trained model directly estimates 5 principal components of blood pressure. Here, we use the meta matching as a phenotype prediction model, which was pre-trained on the UK Biobank dataset. We also ran a free software recall pipeline to generate anatomical mask, which is used to differentiate lobar and deep microbleeds. Blue region contains lobar microbleeds, and the green region contains deep microbleeds. We developed a blood pressure-driven no-new-net framework for cerebral microbleed segmentation. Here, our model takes several inputs, including a T1 and T2 star MRI, and 5 principal components of blood pressure, lobar text, and deep text prompts. Now, the images are processed using a residual encoder, and text embeddings are generated using a pre-trained biomed CLIP model. To incorporate the blood pressure data, we simply concat them to the deep text embeddings. Next, we introduce an anatomically aware joint prompt fusion module. This module takes 3 inputs, the input imaging features from the residual encoder and 2 text prompts. Here, a linear projection layer aligns 2 text prompts to the common spatial dimension of imaging features, then concatenate all the inputs along the channel dimension, process them through stacked convolution layers, and finally fuse with the input imaging features. Now the resulting features are then fed into a UNet decoder to produce the final segmentation for both subtypes. We conducted experiments on 2 data sets. The first one is an in-house data set from Samsung Medical Center, which has 582 cases with an average of 2.9 lesions per case. There are also 39 healthy cases. So in total, we have 621 cases. We manually split them into training, validation, and test subsets while ensuring a consistent lesion distribution across all subsets. For external validation, we utilized the Mikai-Waldo 2021 challenge dataset, which is completely unseen. Here, there's 35 cases with an average of 4 lesions per case, and there are 3 healthy cases. So in total, 38 cases are exclusively used for external validation. We use 4 evaluation metrics. The DICE score was used to measure the segmentation performance. To evaluate the detection performance, we utilized F1 score, sensitivity, and average number of false positives for each subject. Here, we adopted the same detection criteria as used in the Waldo challenge, where a prediction is true positive if its centroid is within 5 millimeters of the centroid of its nearest ground truth. Quantitative results are reported in Table 1. So we compared our method with general segmentation models and text-specific models and prompt-based segmentation models. So our method achieved either the best or the second best performance across all metrics. We also reported the qualitative results for the given T2 star inputs. Results of competing methods are given, and the most competitive baseline is highlighted in yellow. Our results and ground truths are also given. So comparing with competing methods, our results show that our method is superior in minimizing both false positives and false negatives. We conducted 2 ablation studies. The first one is on input prompt configuration. Starting with no prompt scenario, the model was improved by adding more prompts. So here the interesting point is that even with just 2 text prompts, our model outperformed all baselines reported in Table 1. And incorporating blood pressure further enhances our model's overall performance. We conducted another ablation study on different fusion methods. Here, both cross-attention and single prompt fusion resulted in suboptimal performance. Specifically, the single prompt fusion used only a single text prompt of cerebral microbleed, so it did not use the cerebral microbleed subtyping approach. This means that enriching the text prompt with multiple subtypes can improve our model's overall performance. So for more information, you are more than welcome to join a poster session. You can find our poster at B1. Thank you.